Hello, everyone. Welcome to today's discussion on equity, diversity, and inclusion. We have a diverse and well-experienced panel members in today's discussion. I am Professor Sarah Erdahl at Environmental and Occupational Health Sciences Division of the University of Illinois Chicago School of Public Health, and I specialize in environmental justice and community-based research. And with that, I'd like to begin introducing our esteemed panel members today, starting with Gregory Townsend.
Hello, everyone. We can't talk about equity, diversity, and inclusion without talking about racism. So I'm glad that we're here today to open up the conversation about racism. We understand that racism has killed millions and will continue to kill millions of people of color at twice the rate of their white counterparts. Other research has shown that increases of depression, anxiety, and stress among people of color are the direct result of racism, persistent trauma, policies, practices, and norms that sustain concepts of white supremacy. So I'm glad to be here today so that we can open the conversation on equity, diversity, and inclusion.
Thank you. Prestene Garnenez.
Garnenez, Prestene Garnenez.
Thank you.
Good afternoon, everybody. So I am merely just a community member who is a bit of a busybody here in my little community of Red Lake, Navajo, on the Navajo Indian Reservation, the Navajo Nation in New Mexico. And so I care very deeply about my community and the work that I've done really for the past 10 years has been to try to do right by the community. There's a lot of, I think, issues and problems and injustice, even in our tiny, tiny little community in this corner of the world. And so I've made it my work and my passion to try and help with finding solutions and helping to understand why it is the way it is, and how can we ourselves as people who live here in this community, how can we help ourselves be better? So good afternoon, everybody.
Thank you. Thank you. Daisy Magana.
Good afternoon, everyone. My name is Daisy Magana. I work with the Chicago Center for Health and Environment. I'm the Community Engagement Coordinator for the Community Engagement Corps. I'm really glad to be invited to the space to talk a little bit about the communities that we work with here in Chicago. Thank you.
Thank you. Thank you, Daisy. Neilroy Singer.
Good afternoon, everybody. My name is Neilroy Singer. I'm an environmental scientist for the National Science Foundation New Water is Life grant at the Nick College. And I'm here, happy to be on this panel to help answer any questions that I can and to participate in your Zoom lecture today. So thank you.
Thank you for your participation. Maggie Acosta.
Hi, everyone. I'm Maggie Acosta, and I work at the UIC School of Public Health. I work closely with Daisy, and what we try to do in our center is to build power with community members so they can lead change in their own communities. And so we try to do advocacy, we do research, and we support community members in leading work in their own communities.
Thank you. Thank you all for your participation today. I will start with first question. We think that, first of all, I want to thank all of you for creating today's agenda, exciting agenda and very timely discussion for communities, not only in our local settings, but nationally. To orient the audience to the issues, the critical issues that we're going to be discussing today, some definitions would be very helpful. Let's start with that. If you could all please describe what structural racism is, the long walk and boarding school are, and other definitions of importance that we will be discussing today. This would be a great start to our discussion. Greg, would you like to start with structural racism?
So structural racism refers to both political and social disadvantages that people in society are faced with. As we can talk about poverty, the high rates of poverty among people of color or other groups within our communities versus their white counterparts. We can often look at the COVID-19 pandemic as a great example. You look at the people who are dying quicker, faster, contracting disease sooner, and suffering longer. And many of those groups were people of color as it relates. And a lot of that is based upon structural racism. And structural racism is designed so that white people can have certain advantages versus people of color who have many, many disadvantages because of the group that they belong to.
Thank you. Prestene and Neil, would you like to continue with the next important definitions on long walk and boarding school?
Sure. So the long walk happened in 1864, I think, through 1868, when the United States government wanted to imprison Navajos who were doing a lot of raiding with Americans who wanted to take over their land, Navajo land. And so the government solution was to remove us to a reservation that was right now on the other side of the state of New Mexico. And so the United States rounded up Navajos or anyone who looked like a Navajo and marched them across the Southwest to Fort Sumner. And they were there for about 4 years until I think the US government realized that, they didn't have the resources to continue to keep that many Navajos on that tiny parcel of land and expect them to do well. So they reached a treaty with folks who were considered leaders of the Navajo people. And they were then allowed to return to their homelands, which is basically in the area that I now reside. But still beholding to the federal government. A lot of forts were erected in which Navajos were still continuing to report to and to access food and supplies and materials and things like that. But that's my understanding of the long walk. And if Neil wants to add or correct, he's welcome to.
That was good for the long walk, and then I just wanted to add that, you know, for boarding schools, I believe from my experience, I do know a lot of people who experience this era in their lives, the traumatization that happened at these schools. I, for one, recall talking to my parents and my grandparents about these boarding schools, and they basically were sent there to take tradition and culture and language from the individual that were sent there, and you know, there's many stories that go along with this very touchy subject when you ask each individual what they experienced in their lives and personally, and a lot of them don't want to talk about it because it was that bad. And when I do talk to my mother and my dad, who have been in these boarding schools, that's basically what they tell me what it was. They won't want to tell me much more about it because the trauma is still there and it will never go away from them. And that's basically what they said boarding school was to take the Indian out of the Native American, the Navajo, and to take the language out of you. So that's it.
Thank you so much, Neil. Thank you. Thank you all for sharing your
Can I add one more point to that kind of relates?
Of course.
So the dominant narrative, it evolves from white supremacy and racism. One group want to maintain their dominance over all other groups, be it Black, be it white, be it whomever it is, any group that's a non-white group. So a lot of the issues that we talk about that occurred in the past, be it slavery or in those other things, were because one group want to maintain their supremacy over all other groups in America.
Thank you. Thank you, Greg. This was a wonderful and an important summary. And before we go on to the second question, one of the moderators, my colleague Jesse Bliss, could not be here in the beginning, but I'd like him to introduce himself to the panel and also to the audience.
Yes, hello everyone. Thank you so much. My apologies for coming on late. I am the Director of Programs for the National Environmental Health Association, and my name is Jesse Bliss. I've been working with NEHA for the past just almost 3 years. Previous to that, though, I was in academia, and my first faculty appointment was with Dine College. So in that capacity, I worked alongside faculty there in the public health program, the summer research program, focusing on disparities caused by the uranium mining and other challenges facing the community, and being able to highlight and support training of students to be able to respond to those. I also served as Native American Health Liaison for about 10 years at a school of public health in Southern California. And through that time, worked extensively building relationships with tribes throughout the region. And I'm very passionate about the work, and I'm just honored to be here with you all.
Thank you, Jesse. I think we are all very, honored and happy, really. I think that our work is so important, and we're privileged to be working in the area that we're working for the improvement of the public health and also elimination of inequities and disparities that we see in many variables of social determinants of health. In vulnerable populations and Black and Brown communities. So thank you for introducing yourself. The second question is, It is really the focus of today's panel discussion, which is equity, diversity, and inclusion. How do you each define equity, diversity, and inclusion? And this is going to be a collective discussion. Who wants to take the lead?
I could start, Sarah.
Sure. Daisy, yes.
Thank you. So equity, we could define equity as recognizing that not everyone starts from the same place. Therefore, it is for us to cater to people's differences because there is like an uneven distribution of power. And therefore, equity can also mean giving everyone access, opportunity, and support that they need so that they can achieve excellence in their place, be it well-being, be it education, be it health. Now, diversity would be recognizing and respecting and embracing the range of people differences, which include identities, abilities, beliefs, values. And as we continue talking about this, inclusion is creating a fair and equitable environment where everyone is engaged. It is treating people with respect and and making sure that their contributions are valued. For example, it is crucial, we usually use the analogy of a table. It is crucial to bring people to the table. It is crucial to bring our community partners to the table, but not only for them to be present at the table, but for them to be able to add to the menu, for them to be able to share their concerns, their contribution, and for those concerns and contributions that they made to be taken into account, to be valued. So as we speak about this, and we're going to be talking about communities and how we work with community, this is, like, as you mentioned, the base of what we're going to be talking about. So that's how we define equity, diversity, and inclusion. And I'll pass the mic to my colleagues.
Thank you, Daisy. That was a great summary. Would anyone like to add to what Daisy already so eloquently described?
Yeah, I think Daisy gave us a perfect definition. I would add that justice and fairness are two components of equity, diversity, and inclusion that we cannot leave off the table. I like the analogy of the table, to making sure that everyone is invited to the table, and not only being invited, but they are equal participants in whatever is being discussed, no matter where they come from, what station in life that they exist in, that they are welcome and invited and treated fairly as they enter that space. So thank you.
Mm-hmm. Yes, I think that another thing that, Daisy already mentioned, but I'd like to highlight is respect. I think that is so important because all these values are tied to one another. If you are respectful, with that comes, the other, consideration, justice, and equal opportunity. They are all tied together.
Can I ask a variation of the question? And it's because I've heard a lot of people that they look at it and they say, well, let's just push for equality. So let's give everybody the same thing. And there's challenges with that. Would anyone be able to speak to that?
Yeah, I can start it off, and I know that others can chime in. I love the beautiful illustration. There's a woman and a man running a 100-yard dash, and the man is a white man, the woman is a person of color, and the man has a clear path to the finish line. However, the female has so many obstacles: barbed wire, holes, tires, whatever fences that's in her way that would impede her progress to jumping, reaching the finish line. And actually, she started behind the person who was the white person on the other side of her. So when we talk about equality and equity, you cannot give everybody the same thing and expect them to reach the finish line, because people start at different places.
Thank you. Thank you, Greg.
Can I just also add that that is absolutely true, and I have a real life experience with that exact situation. So I helped start a charter school here in my community, and we had this one student who had both parents. One of his parents is a teacher, and he's a straight A student, comes to school every day, he's never late. And we had this other student who was 2 grades behind already when he entered our school. And every day he would come in at 8:40, and classes started at 8 o'clock. And we had a policy of 3 tardies that counts as 1 absence. So if we applied that policy to him, he would again end up having this record of having a ton of absences in 1 school year, which would also probably count toward him not being able to move a grade up. But when you really look at his situation, his parents, I mean, they drank a lot. And so his mom was usually out of it. He would spend his mornings getting his younger siblings ready, walking them to elementary school and then walking to school. And he would get to our school at 8:40 every day. If you looked at his school record, you would see too that in his previous school, they always counted those tardies against him. And that's one of the reasons why he was held back 2 years.
Mm.
And so my recommendation to the principal was like, let's not fault him for that, because this kid is essentially raising himself and his siblings, whereas this kid with the 2 parents gets to be a kid.
Mhm.
Right? We could apply the policy to both of them, but would that be fair?
Mhm. Thank you. That was really, I think that you summarized the issue so well with a real example. Jesse, would you like to present the second question?
Sure, thank you.
Actually, the third question, sorry.
So the key lessons question, correct?
No, what are examples of trauma?
Yeah, okay. So yes, with in this the same vein, we recognize the impacts of trauma are important. So could you talk about some examples of trauma induced either by historical or cultural or systemic practices? And kind of a follow-up component to that is, how does trauma impact communities in general?
I can start again, and then I'll slow up. When I was 12, walking home from middle school, I was confronted by 3 police cars with their lights on. They stopped me on my way home from middle school at 12 years old because they said that I fit the description. What was the description? A grown man who happened to be an African American had assaulted a white female. I was 12. They put me in the back of the car, drove me back to this female's house, and she looked at me and said, "That's a child." This was a grown man who assaulted me, not a child. They took me home, dropped me off with, "Oh, we sorry," is all I got. But the memory, of being, the trauma of being a Black male, growing up in a white society, has followed me all the days of my life. Anytime a police car stopped me, I have to make sure that I do all the right things that I was instructed to do when you are confronting police officers. Be respectful, be obedient, follow instructions, or you may die. And then I see the trauma of a George Floyd with a knee on his neck. And there are many, many other examples that Black individuals, both male and female, face when they are confronted by law enforcement in America.
Thank you, Greg. Would anyone like to add? your examples of trauma?
For some of the communities here in Chicago that we have specifically worked with, we can see that there is, like, for instance, in the Latino and Hispanic communities, we consider there is like legacy of colonialism, legacy of pollution. We can see violence. And one of the biggest trauma that I have seen around our community is that migration related stressors and family separation that has happened. And we see that these are like intergenerational trauma that continues with our community.
Yes.
Before I go on to the next part again of the question, I would also say, in asking it, and we say, what are, how does trauma impact communities in general? But something that you just spoke on there across the community is the trauma isn't always a big event that happens. Can someone speak to the microaggressions and the impact of trauma that those can inflict, as you're talking about kind of a community in general being affected by trauma?
Going to the grocery store or department store to shop, and you look around and you notice that someone's trailing you. I have a master's degree. I've worked as a health care administrator in public health for 25 years, and how dare they follow me around the store when I have money in my pocket. So that to me is, being profiled, and it creates fear and anxiety, not only amongst me, but I've heard other people of color talk about, that invisible layer of racism that's always hovering over us.
I agree. And I think what I feel like, and this is something I was just talking this morning about with my staff, and I want to try to have my staff be empowered and understand that they do have a voice in this organization and their voice is important. But we were talking about how overall in the community, maybe even across the nation, how folks feel like they are not empowered to speak. And we were talking, that's sort of going all the way back to the long walk of when people were not allowed to question authority, right? And so that is still here today affecting our communities, and that our communities don't have the power themselves to make the changes that we need for ourselves. And it's relating to the question further down about white savior, that it takes somebody external to our communities to come in and save us. It's gotten to the point where we no longer believe that we can save ourselves, that here's a person who looks like me. We've created this doubt amongst ourselves. This person who looks like me can't possibly be able to help me.
Yeah, and that's called internalized racism, where we attack our own groups and we don't accept our group. The water made by a white person is always colder, and the water comes from the same source as the Black person, but that water or that ice is always colder when it comes from the dominant group.
Right. Right. And so I feel like that's the trauma that we continue to deal with in our communities here. As a person who's,
yes.
Go ahead. I'm sorry.
No, I just say thank you. I mean, what you were saying right there, Gregory, your comment lead perfectly in the last part of this question, which is, why is a trauma-informed approach to working with communities important? And I would say in that trauma-informed, someone like me, I don't have that experience. And how can trauma-informed change the way that is done? I don't question the intent on things if someone's walking behind me in the store usually, right? And I recognize that is different. So that trauma-informed approach, why is that important?
You can't know if you don't ask. And if you don't go into community and listen to what the community is saying, you'll never know what the truth is. We can pull out academic journals and look at theories and concepts and frameworks. But when you get deep into the community and allow people to talk from their own perspective and tell us how they have been injured, hurt, harmed, traumatized by living in society, you'll never know unless you hear it from them. Because what we think we know, oftentimes we don't know.
Yes, this is completely my experience as well, Greg, that working with our communities on the west side and the southeast side in Chicago and the south side in Chicago, every day we learn something new from them. And it is a constant learning experience. And of course, in our case, we're hoping that that is reciprocal, that they learn from us and we learn from them. And thank you for this lively and very informative discussion.
Can I add one more thing?
Sure.
Jesse, you can't go into a community if you don't have thick skin. I have walked into communities and have heard some of the most horrible things directed my way because of their fear and their trauma. One lady said some, just tore into me for 30 minutes, just blah, 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 you this, all types of words that you cannot say in a public setting. But I heard those. But after I stood there and listened, I developed a relationship and was able to talk to them. And then I found out what the real issue is. Sometimes the issue is us who are professionals. We create the disconnect with the community, not the community. They want help, but we go in and help them in the wrong way. So,
absolutely. And then Maggie, you have a comment?
Yeah, I'm so glad you brought that up, because I think that helps us kind of take what others have emphasized here as like a structural approach. I think it allows it to see it as it's not us individually or any individual particular person, but that the trauma is historical and structural. And when we can pause and see that, I think that also opens up really important doors for us to see that a trauma-informed approach also requires structural change, right? So through looking at it in a more structural sense, then we can also identify, bureaucracies have also made it hard for community members to have their concerns heard. Institutions like academia and city government have also made it hard. And so once we see it that way, I feel like that also does allow us to be more inclusive, have more diverse voices at the table, and to change the root causes of what make inequities in the first place.
That's right.
And I would like to also to add in there is that it's not enough just to go in and ask the community and to learn from, because you need to understand some of the concepts behind trauma before you go to ask what the trauma is or what is the experience there. That way you have a way to work from, because if we don't understand that, when you have someone coming screaming at you and telling you all the names under the sun and they're coming at you, and how are you going to internalize that? Do you understand that that is a sign and an impact of this trauma? And how do you may not be expecting to go look at trauma when something like that happens. And yet, if you understand and you're trauma informed in your approaches, when you recognize that, you can take a different approach in your engagement. And we need to really be cognizant. You all have just really hit this really important concept. And Sarab, thank you for giving us a couple extra minutes on this question, because this was vitally important.
Thank you.
When we're talking about doing something, if we want to do an intervention or a program or anything, this is.
Yes, this is really one of the very important issues, and thank you so much for reminding me of our timeline. With your permission, with the permission of all of you, I'd like us to move on to question 4, that we have 5 more questions, and we want to make sure that we have time to be able to have similar, very enriching conversations about them as well. The 4th question is, what are some key lessons about knowing your community and incorporating equity that you would like to share with us today? And who would like to take the lead?
I would speak to the work, Sarah, that you and the center have been doing for a long time. And I think it is important that we understand that getting to know your community takes commitment, time, and resources. So as you guys have been talking about having that trauma-informed lens, it does not go like one day, the next day you have to do a project, you go into this community and that's it. No, it starts like from the beginning. It starts about incorporating equity, committing to principles that speak to what we were just talking, like anti-racist communities engagement principles that we have in our center. That includes like what Maggie was talking to, what Greg was talking to, like critical reflexivity as us as individuals, as researchers, acknowledging to what Jesse was talking to, acknowledging our power dynamics, acknowledging our positionality, and leveraging all the resources we have so that it could benefit the community, so that we could share these resources with our partners. And I think it is also, when we talk about equity, is like incorporating or including all stakeholders across this continuum from, for instance, us in academia, from research design to instrument development to data analysis and to like knowledge translation strategies. So I think it is at the end of the day, like creating these opportunities and supporting like community leadership and ensuring that we involve them in every step of the way.
Yes. I think what you're talking about, for me, my understanding is the community-based participatory research, which has really changed the dynamics as it relates to building relationships. But before you can build relationships, you have to build trust in the community. They have to trust you. They have to see you as one of them. And for example, you know, I do a lot of work, some work with police officers, and they ask, why can't we get and create relationships with the community? I say, first of all, you build fear in the community, so you have to diminish the fear. Secondly, you need to get out of the car. You need to get out of the car. Why do you need to get out of the car? You get out of the car to listen to the community. You get out of the car to learn from the community, and you get out of the car to lead. You can't do that just riding around the community. All they see is your tinted windows and your car. Yeah, and that does not build relationships. You have to open the door, get out the car, so they can see you as a human being.
Yes, I'd like to add that knowing your community is one of the key lessons that I've learned as a research scientist out in the field. Working with volunteers, gathering volunteers, their interests, and knowing their, you know, how they live, their lifestyle, and also bringing outside scientists into the community to give them a feel about how the area is and their landscape, why the do's and don'ts, the taboos of the traditional culture, the ecological knowledge that every person out there is their own scientist, is their own professional of everything, because they've lived there all their life. Right. And they are a doctor in their own world. So
that's right.
Who are we to go out there and tell them how they can act or be in their homeland? So to gain that respect is something really carefully done by me and our other scientists that I've worked with, is giving them the chance to gain that relationship, gain that trust. And one of my colleagues always told every scientist that we brought into our community, if they start calling you my cousin in our native language,
brother,
you have done good and you have done well and you are ready to go on further. And you come back and you always say, hello and how you're doing to everybody. So those are one of the lessons that I've learned working with my community. Thanks.
Yeah, I concur with all what has been covered thus far. And I always give this example in our undergraduate course in community engagement to our class every year. Knowing the community is both ways. You're knowing the community, them knowing you. And the trust is the critical element of that. And when I was writing my first environmental justice grant, and I truly thought that, the work that I was proposing would significantly benefit this community on the southeast side of Chicago. And I literally reached out to them 50 times. I've become a pest completely, and, almost to the point of stalking them, but they didn't know me. And they didn't want to. They said no. They still said no at the end of all that effort. And I was, of course, heartbroken. And we did get the funding from CDC, and we did the project, and they were unfortunately couldn't be part of it. But then, we worked on other projects. Now my relationship is no longer 50 times calling them, but just writing a quick text message and saying, what do you think about this? And, getting a letter of support right away. But that took almost more than a decade to develop. So, because they didn't know me and they didn't trust me. And I think that was the underlying, and they were absolutely correct. And so I think that you crystallized all these with your own discussions.
Could I also add,
Sure.
We have to make sure that we talk to the right people in the community. Sometimes we go and we talk to the people who are talking the loudest, who look real good, and we select them thinking that they are the leaders in the community. And they may not know, even they live in the community or exist in that community, they may not know, they may be out of touch with people in the community. So you have to look for both those traditional leaders, those politicians, or the people who are always the advocates in the community, but you also have to talk to people who sit on their porch, but know everything about everybody in the community. And they may be either the matriarch of the community or the patriarch of the community, and people respect them. They look at them when stuff is going on for advice, not those traditional leaders. They look to Miss Sue or Brother Tom, for advice first. Mm-hmm. And if you mess up with them, you lost the whole community.
Yes. I would like us to move to question 5, Jesse, the effective strategy question.
The next question is, what is an effective strategy to introduce environmental justice and EDI to individuals who have only experienced a limited number of cultures?
I think Greg said it before. One of the strategies is just to get out there in those communities and start experiencing those communities. And if you want to do additional research, I think like for tribal communities, there's starting to be a lot of, folks writing about their own tribal communities now. There's a lot more information out there. We have the internet. There's just so much, with, you want to see socially what's happening in a location. There's the TikTok influencers now. And so there's just so much, there's so many places I think that you could go to do that. But for sure, I think getting out in the community and experiencing the community is key.
Yeah, and Daisy said it eloquently earlier. We got to see who's at the table, make sure everybody's included at the table. And then if people aren't there, we got to find them and invite them to so that they can come to the table, and also give them a voice while they're there, and then invite some of those people who are non-traditionals of that community so they can see those people not as outsiders, but as partners in rebuilding communities in an equitable way.
Can I also I'm going to give an example. 5 weeks ago, I was at a tribal environmental conference in San Diego County with the Paula tribe, and the environmental health director for the tribe got up and she said, "I've got some advice for those of you that are here that don't know us or haven't worked with us before. You're coming from agencies, organizations, universities. Here's my piece of advice." That she paused for dramatic effect. And she said, "Shut up." And she said, "You're not the expert here. You're not coming in with the answers. You're not coming in with anything to offer until you shut up and listen and hear and are invited to the table. So come in." What reaction do you have to that? Is that part of a strategy? Is that a framing that needs to take place?
I think it is. You know, earlier when we were talking, and I was just thinking one of the strategy needs to be just to listen, to truly hear what communities are saying. If that one person in the community wants to speak and call you every name of the book, you just have to sit there and listen and not try to offer solutions right then and there, right? Because I feel like we get a lot of folks who are consultants who want to fix things here for us. And I start to tune them out and turn them off when they try to come at me with what seemingly are easy fixes. You know, and then I know I'm listening to a salesman too. So if they're talking more than I am, then I start to tune them out, right? It's a sign of respect, you know, just to listen to folks. I mean, we say that all the time with our elders. Our elders can talk for an hour, but we have to be respectful and listen to that for an hour because there's wisdom in that. There are some answers in that. And I feel like when folks who are outsiders coming into Navajo, yeah, you really do just need to realize you're not the experts. You won't have all the answers for us, and you need to listen.
Yeah, we need to leave our arrogance at the door.
Yes.
When we walk into different spaces. And because we have degrees and we understand all these concepts and theories, we think we know it all, but we really don't. You know, and expect opposition. Expect when you go in the community that they're going to come at you. First of all, to challenge you to see if you're real, because you can go into some communities, they're going to test you. They're going to test you. Are you genuine? Are you live? Are you Memorex? They're going to test you. And then if you fail the test, again, you cannot come back. They won't invite you back. You have to work real hard, provide a lot of incentives in order to get back into that community. You know, because like I say, you only have one chance really to put forward the best step that you possibly can.
Agreed. So my 7 years as a field scientist and starting projects, we always started with a listening session. Close your mouth and listen to the community, because we're not miracle workers. We go there and all we can do is provide data and hope for their support and gain their trust. So that's how I've introduced, environmental justice, bringing a lot of other entities and stakeholders to the table to help in this process. So that's been working. So
I would add to that, to what we've been talking about, how important lived experiences are. Like, these are the experts in their community. If they invited you to sit there, that's the opportunity for you to sit, to listen, to know, because sometimes we come with this preconceived ideas, this assumptions, this is what this community need. And in reality, they have other urgent needs, other priorities that does not involve that. So how do we address those things? And that's when we start working with other stakeholders, working with other organizations, be it grassroots organizations, to understand like what's the history of this community. Like, for instance, with the communities at work, like, is there an issue with legacy pollution, like environmental racism? And so we start listening and working and take the great knowledge that this community gave us, because they live there, they live, they play, they work, they sleep, they eat in this community. So their lived experience is really important.
Yeah, I worked as a hospice director for 8 years, and in taking care of people who have a limited amount of time on earth, you have to make sure that not only their physical needs are being met, but their spiritual, their emotional, their financial needs, make sure their family are taken care of. Then they can die in peace. But they have confusion and chaos within their home environment. Oh man, they're gonna be tragic also. So we have to be holistic in our approach in terms of identifying needs.
Mhm. Yes, I think that, these listening is really it's just the most important skill to have, but listening in a genuine way and really absorbing the information. And that's what, we keep saying to our students in our community engagement course every week when we meet with them. Knowing your community means listening to them and learning about their lived-in experiences in a genuine and authentic way. And with that, I'd like to move the discussion to the next question, which is really important. Could you please discuss how non-tribal community engagement practitioners can learn more about tribal culture to improve their overall engagement? Prestene, would you like to begin sharing your wisdom with us?
Yes. Don't read Tony Hillerman novels. No, but seriously, I think that in this day and age, there are many ways to learn about a particular tribe's culture. We've mentioned before, just going to the communities and experiencing the communities. There's so much out there. Like I said, you can come to Navajo right now all with social media. There's so many things on social media that sort of just packages the quirks about Navajo and being Navajo and living on Navajo, living on the reservation, or even a Navajo living off reservation right now. And there's a lot of Navajo academics now putting out books. Not to plug, but she's my good friend, Sherry Mitchell, who wrote Sacred Instruction. And, looking to, works like that, I think is very helpful, and then it's just coming in that you're not the experts, you're there to listen, there to learn. I used to have a problem with the kids who come out to Navajo and want to do the Teach for America kids, because a lot of them would come with this sense of not so much being a part of the communities, but observing the communities. Mm-hmm. And I got to a point where I sort of resented some of it. I mean, don't do things like that, right? Come in to truly understand with that open heart that, yeah, we might do things a different way than you, but that doesn't mean that it's wrong, right? And we can sense those things in our communities when someone's coming with maybe a different intention than what they're saying to. So I think there's tons of ways that you can learn about the communities that you're wanting to help.
Mm-hmm.
Thank you, Prestene. I have an example of that, which I thought was pretty cool. My colleague recently retired, Perry Charlie, and he was grown. He grew up traditionally, and so his knowledge is he's almost an expert. He's a doctor in traditional knowledge. That's what I think. He doesn't want to believe that, but I believe he is. But the people that we our other organizations that we work with, they decided to design a logo for their organization, a new logo for a water restoration project or something like that. I forget what it was, but they drew all these they drew an emblem that had dealt with environmental design. It had a mountain, it had a moon, it had a wolf howling at the moon, and it had stars. It had everything on there that, in traditional knowledge to Navajo, some of those are taboos. So they reached out to Perry and asked him, what do you think about this logo? So right away, he wrote a big email stating what all these, to be careful on using these images and using how you use these images and before you put this logo out. So those were, that would be an example of knowing who to reach out to and asking for advice before you even just do something. Ask the community, ask a member. If not, they'll point you to someone. That would be, how they would improve their overall engagement. So that's a prime example there. Thank you.
Yes. Yes, thank you so much. We'll move on to our last question. Jesse, if you could take the lead on that, please, on what's important for people to understand when engaging with communities of color.
Yes, a great question. As you just heard, everything we've talked about today, if we're wanting to make sure that people understand how to engage, what is the most important key things? I think we've said some of those. This is an opportunity, I think, to summarize and highlight what you believe are the critical points.
What do you think is the most important when engaging with communities of color? I think we've already discussed many elements, but I think this is a great opportunity to highlight them, those key points.
I would say, Sarah, that one of the things is that we've talked about the trauma-informed approaches earlier. I think it is important for us to acknowledge that, recognize and understand like our role, for instance, the power dynamics that indirectly or directly affect when we're working with this community of colors. I think, for instance, in the Latino and Hispanic communities, it is important for us to understand, for example, that our strategies, be it research or working with these communities, have to be inclusive. And that means like recognizing that we have a lot of undocumented population and that who do not participate or decide not to participate in some of the research or data gathering activities that we have due to fear of discrimination, harassment, deportation. So I think it's really important for us to think about that. It is also important, as I mentioned earlier, to acknowledge our own institution and the power dynamics that it takes, remembering that we also have the opportunity to create safe spaces for community members. We have the opportunity to enhance their skills. We have the opportunity to put them as leadership positions. And I think, again, and lastly, I would say that we have to keep in mind that when we come into these communities of color, that we need to address the community needs, but once we hit the ground and start running, we need to work alongside with the community, not work in the community, but with them. And I think that is very, very important.
Yeah. I have 4 things that I wrote down. First of all, you have to understand the historical context of the community. What has been their past experiences and trauma that they have faced in their community. Really understand that from not only a global perspective, but from a community perspective too. Understand the cultural norms in the community. Don't just walk in and think you know everything about that community. And I think it was Neilroy said that you have to understand what are the cultural norms in the community and what things are taboo in that community. Go in the community with the idea that you're going to lead by listening, learning, and leading. You know, just don't think that you are the expert. You are not the expert in that community. Some of those people may not have any education, but they are educated about their community and understand that. And lastly, we have to build trusting relationships. If you are kicked out of the community day one, try to find a way back in, because they may kick you out and say don't come back, but keep going back. Keep going back. Show your leadership by returning, and don't be afraid to go into communities, because again, it's like sharks. They sense blood. You know, you go into a community, they sense your fear. Also, if you're afraid to go into community, I say stay away. If you're afraid, stay away. So those are some things that I'd add.
Thank you, Greg.
I also think that you know, if you find someone in the community who could be a champion to work with what you're trying to do in the community, I think it's important to build that partnership with that person, right? And if they're not your traditional community leader, right? They're not the president, they're not a council member, that's okay. You know, because I'm not an elected official in my community, but I try very hard to do things to improve my community. And what I feel like also would be helpful to me is having the acknowledgement too from my local community leadership with the work that I'm doing with this partner, right? And sometimes, I'll just be blunt, sometimes I ask folks like, can you talk to council and, you know, this is what we're trying to do, and so it's like strategizing even with the person on the inside of that community, right? Get some clarity about what you guys want to do. Because I think that that's important too. But I also feel like for me personally, I struggle with my own, what we're going to talk about soon, the internal racism that Greg brought up before with my own community, and not having the support sometimes of leadership with some of these initiatives that need to be done to improve our community.
Hey, and one thing we have not mentioned, we have to check our own biases at the door also, because all of us come with our own stuff, our own messed up, stinky, dirty stuff that we need to leave behind. We need to understand what our biases are. Then from that point, we can create collective impact. You can't save the community on your own. It's going to have to take everybody working together, inside, outside approach, working together to rebuild communities. You can't save them. It's going to take all of us working together to become the saviors that need to occur.
Yeah, I agree.
Thank you so much.
You have to be healthy before you help others. Yes.
Yeah.
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 Yes. I think that for me, the most important thing is each time I'm thinking about it or working or meeting within a community, my frame of mind is community empowerment. what can I do in small, large ways to empower the community? So I think that that goes, the trust, listening, the this, authentic engagement, being sensitive to the community's history, cultures, values, and all of those are embedded into this community empowerment concept. And so we need to educate more young people, and we need to disseminate our knowledge as we're doing today to others who are doing this type of work. And I want to thank all of you for today's very informative and enriched discussion. And thank you so much for lending your wisdom and sharing your experiences and expertise with us today. With that, I'm going to turn it over to Jesse for concluding remarks.
Thank you so much, Saraf. You have really summarized and said what needed to be said. What I heard people on the panel expressing, each of you, are so key to being able to work towards a collective and collaborative engagement that's built upon trust. I heard trust over and over again. And so, we have to seek to build trust. And to do that, you have to be trustworthy and put yourself out to do that. You have to be quiet to learn what the needs are and listen to what is really needed and show that you're going to take action on those needs, not on your priority. My priority may be environmental health, but if I go to a community and they say, our kids can't get to school because they're walking through 2 miles of mud, that's their priority before we talk about the water quality. And I have to recognize that. Let's address where they're at. And you mentioned trauma-informed care and using that lens in all that we do and ensure that you understand that. And so these are key in identifying your community leader, your trusted source. You're not going to be the trusted source, but when you work collaboratively with someone who is, you'll get so much further. Such wisdom from each and every one of you. Thank you all so much. Again, a great honor to be a part of this panel and to be alongside as we seek a way to help students and others who will learn from these resources how to better engage their communities and to do the work that they're trying to provide support for in the future.
Thank you so much, everyone. Have a great day.
Thank you. Thank you
Take
for
care,
inviting me.
everyone.
Bye, everyone.
Enjoyed it. Take care.